This Establishment Director of Health and Security, Cynthia Marshall. Thank you.
Thank you, Claude. Good evening, everybody. Good evening to you. My name is Cynthia Marshall, and I'm the administrator of the Health and Security Plan. And from all the calls that I've been getting, I know a lot of people are not satisfied with the level of service you've been receiving since Sandy. But I'm here to help you get better service and to put things in perspective for you. As you know, and I will repeat it, that our building has been demolished. Well, not partially, not completely, but it's not functioning. And as part of the building, the Health and Security Plan had to secure locations. To be quite honest, we have about 16 different locations between all the benefits that we provide. And most of those locations were not able to receive our members coming in. But we do have one central location, that's 1407 Broadway at 39th Street. We're on the 10th floor, and you can access all the benefits as a walk-in person, as a walk-in member. In addition, all the telephone numbers are there, and all the benefits can be contacted at that location. I have for you, which I will give you before I leave, a list of all the telephone numbers for all the benefits that you can reach. And if all else fails, I'm going to give you my office number, because someone is always there, and it's 212-815-1305. But I will leave the list here. We have several copies, and I'm sure you'll make more. But what we were able to do was to transform most of our numbers from the union directly to this location. So if you were used to calling certain numbers for certain benefits, you should try those numbers, because we were able to move those numbers to the location that we had. The general number 1234, there's a lot of complaints that people are not able to get through. However, that number is functioning, plus the 1,000. We have been able to get up to date with all our claims. The only benefit claim that still lags is the dental benefit. So we have been working overtime, most nights, most weekends, to get up to date. But that is still a lag in terms of getting the claims processing, getting them up to date. We were able to get all the other benefits. Dental is still backlogged. What we have heard is the dentists are unhappy, and we have, to a certain extent, tried to compensate those who are the big providers. At one point, we sent out 25% of their annual earnings to 75 of our top producers to help them along the way, because as you know, they rely on our members for their money, but to pay their staff. So what we did is we forwarded money to them, and with the hope that they would continue to provide the benefits to our members. There are some doctors who are saying we'll not see the members or treat them unless the member pays. These are participating doctors, and although we do not have it in the contract that they cannot ask for payment, they have a right to ask for payment. But before you pay a dentist, please call my number, because we have been able to discuss the situation with each dentist that calls and get them to agree to see the member without having to pay. And we crave your patience and your tolerance in helping us. This is part of the thing is, I don't think a lot of the members realize what we're going through. And I encourage folks to come up to 1407 to see. We have one about 30,000 square feet with the entire plan. So we're trying to function under some very hard circumstances. We got the location without paying rent, thank goodness, but we've had to provide computers and other equipment. So with members and our employees and your employees of the plan, are working under very very harsh conditions. So it will be helpful if you show your support and try to understand their perspective as well. I know it's not easy when you have a disability claim and you need payments to pay your bills, that the claims are not being paid. But thankfully, I was told today that all disability claims are up to date, and the only ones not being paid are the ones we're waiting on additional payroll information. So I think under the circumstances, that's pretty good.
Thank you.
One thing you know, I don't think anybody can compromise or say that their drug benefit was damaged, because we were able to work with Optum and UHC that provide benefits for actives and retirers, that when our systems were down, we were able to utilize their system to continue the eligibility. And I don't think anybody who was eligible were denied benefits. So I think if you're having problems with your benefits, especially drugs or dental, please call my office, because that should not be happening. I also, Mr. President Ford mentioned to me the dentist, getting benefits, and your telephone numbers. Those things I know are the first three priorities. Are there any other questions that I can answer for you tonight? In addition, remember the numbers are coming around where you can, and there are more than one number for each benefit, and you have my office number. So are there any other questions that I can answer for you tonight?
Just a very simple one. It's probably not related to Sandy, but I want to make sure, now that I have all the numbers, can a legitimate dependent call and discuss benefits, or does it have to be the member?
It has to be the member, because everything in the system is based on the member and the member's social security. And we have numbers that are questions to verify who's calling. I wouldn't like the member dependent to call and not be able to answer the eligibility questions that we have to ask. So please ask the member to call.
Thank you.
Okay?
About how long is it for a new member to get into the health benefit system? Because I too have new members, and they're asking, and I don't want to open my mouth and say anything without a good idea considering the situation you're under. That's the first question. Second question is regarding dental benefits, regarding reimbursements to persons. You've talked about to dentists and what have you. About how long is the backlog to reimburse a union member directly? Because that I get a lot of also. If you could, give an answer to those, would be appreciated.
Okay. As soon as we get the information in terms of getting the new member in, we have access to put it on the database where we are at 1407. You will get them up as soon as we get information in our hand, like the enrollment card, the birth certificate, the death certificate, whatever it was required, the marriage certificates are not there. We can get them up. As soon as we get them in, and to expedite the situation, you could bring those forms to 1407, and we will get them up, eligible for benefits, okay? In relation to dental benefits for individuals, we don't segregate the claims for individuals as opposed to dentists. As they come in and they are processed, they go right in the queue. But if there's somebody who has been waiting a long time for the benefit, please also give me a call and we can track it. Okay?
Thank you.
My question is, wouldn't it be a good idea if we use the ID from this card instead of Social Security on the claims? Because the union already has the Social Security. Because at this moment the Social Security might be somewhere, nobody knows where. And I'm thinking safety first.
We have both in the system, the PID number and the Social Security, and we prefer really for the member to use the PID number. But in relation to the claims that may have been lost, some may have been lost, because if you remember, during the weekend we got mail, we were sending checks out, and then the mailroom got completely overwhelmed with water. So it's quite possible that some claims were lost. But if you have been waiting a long time for a claim, please call the office and we'll try and put a trace on it. Okay? Any other questions?
Cynthia, just say your number one more time, because now people have the form, they may want to jot it on the phone.
Okay.
Just let us say her number one more time.
212-815-1305.
If I have someone who has a child who is is now 19 years old, is that child still covered for drug benefits?
We did a mass mailing to all members who had children aged 19, because that's basically when the benefit ended, up until age 23 if they were in school. If they were not in school, the benefit ends at 19. If they're in school, it ends at 23. We did a mass mailing about a year ago to all the members for them to enroll, even though they were in school and eligible, to enroll them so they stay on our system as eligible from 19 to 26. So if you've not done that, please do that. Okay?
Thank you. Thank you very much.
I think I'm getting the hook. So thank you very much, and I'm ready to come back anytime you want.